Hello everybody and welcome to the Knowledge Exchange Collaborative webinar. This is our fourth webinar in a series for the Knowledge Exchange Collaborative, which is hosted by the Mental Health Commission of Canada and the Canadian Centre on Substance Use and Addiction. The goal of this collaborative is to bring people together who work in the fields of mental health, substance use and addiction, and who are interested in learning more about knowledge exchange and different kinds of projects. So as part of the collaborative, the MHCC and CCSA are hosting a series of webinars on a quarterly basis to highlight and discuss key issues and topics in related fields. So we're really happy because each time we host one of these, our numbers go up. So please spread the word if you like the content of our webinar today. And let's get more people connected to learn together. My name is Liz Wickfull, and I'm the Manager of Knowledge Exchange at the Mental Health Commission, and I work on this project with a number of people. So I'm going to go to the next slide. So before we begin, just to let you know that audio is provided in broadcast mode through your computer speakers. You can also call in, as a number of you have, but if you have called in, I'd like to ask you to please mute your phones so that it doesn't interfere with the presentation. At any time, if you have any technical difficulties, we'll ask you to connect with Adobe Connect directly, and their number is 1-800-422-3623. You can also download today's webinar presentation by clicking on Download File located in the top right box. You can see that right on the screen. And you should know that the webinar is also being recorded and will be posted with a French translation of the slides on the MHC website, probably in a couple of weeks. If you have any questions or comments, please do type them in the Q&A chat box located on the bottom right of the screen. We'll have time for questions and answers at the end of the webinar. So for today, the title of our webinar is Implementing Digital Innovations for Success, Example of Knowledge Translation Tools in the Field of E-Mental Health. And we're very lucky to have two really great speakers with us today. The first is Dr. Danielle Impey, who is a colleague of ours at the Mental Health Commission. She's the coordinator for the E-Mental Health program. And her background is in mental health research and knowledge translation. Danielle completed her PhD in experimental psychology at the University of Ottawa, and her thesis research examined cognitive and psychosocial outcomes in various clinical populations at the Royal Ottawa Hospital. And during this time, she became involved in mental health education and promotion, and she's going to be talking to us about the e-mental health toolkit that will be launching very soon. Dr. David Wilger is a member of the community, providing groundbreaking perspectives and inspiring contributions to digital health policy, management, education, and evaluation. David is the Executive Director of Education, Technology, and Innovation at the University Health Network, and he's also an Associate Professor in the Department of Psychiatry, Faculty of Medicine, and the Institute of Health Policy Management and Evaluation at the University of Toronto. That's quite a mouthful. David's also one of our Spark mentors, and we're very pleased to have him with us today. So, on behalf of all of us, thank you for joining us, and I'm going to now hand over to Danielle.
So thank you, Liz. So hello, everyone. As Liz said, I will be talking about the e-mental health implementation toolkit. So this toolkit is one of our many initiatives as part of the e-mental health file, which is part of the knowledge exchange team here at the MHCC. So I'm going to be running through a little bit of what e-mental health is, first of all, some examples of some tools that you can use yourself or in your practice or at your organization, and then I'm going to be going through the toolkit itself that explains about e-mental health tools and also how to implement them. So I realize that maybe not everyone is in a position where they're able or thinking of implementing e-mental health, but I hope that this presentation will at least open your mind and give you more information about this mental health option. So first, what is e-mental health? So it refers to the internet and other electronic communication technologies to deliver mental health information and care. This can, of course, be about mental health or substance abuse issues or anything included in that realm. These services are found to be an effective and complementary option to traditional face-to-face mental health support. However, it's found that e-mental health technologies are underused as a mental health care option. So some of the reasons or common barriers why these might be underused is administrative hurdles, privacy concerns, lack of leadership or really buy-in for e-mental health tools, such things as legislation or unknown or not being informed about what the possible costs are or infrastructure are involved. So we are hoping that the toolkit will provide some of those answers and those best practices for how to implement e-mental health. I should also mention that the target for the e-mental health toolkit is for mental health practitioners and other allied health professionals who are looking to incorporate this, but it's not exclusive. Anyone can use this resource. We are officially launching this resource next Tuesday. It will be available on our website, on our e-mental health website, on the MHCC webpage. So this is this webinar, if you're listening in live, is a little preview. So the implementation toolkit, the main purpose is to accelerate awareness, uptake, and implementation of e-mental health among practitioners. The format of the toolkit is in 5 modules, so I'll be going very briefly through each module about the objectives and the content. I will not be touching on the mini case scenarios. These are practical examples that are based on real life that can guide you through how they can be used. These mini case scenarios, action activities, and linked resources are really important if you're looking to implement an e-mental health plan. So I really encourage you to go seek out the toolkit when it's available next Tuesday. There's also 12 appendices, which include work plans, worksheets, surveys, questionnaires, everything, all materials that you would need in implementing as well, which unfortunately I will not touch on this webinar today. So the first module is exploring the world of e-mental health. So the objectives for this module are to recognize opportunities for e-mental health integration in practice, to obtain a detailed understanding of the range of e-mental health tools and applications currently available, and to be able to evaluate the quality and appropriateness of different e-mental health tools, or if incorporating e-mental health is appropriate in your case. So some of the types of e-mental health technology, there's quite a range here. So the ones that you might think of are cell phone apps. So these are applications that are available on your cell phone. They're available mostly 24/7. The client can access mental health care information right at their fingertips whenever that they want to access it. So this could be, for example, a mood tracker. This could be a diary to help you keep track of and kind of warning signs for signs of stress. David will be talking to you about an app like that after this talk. It can also be to track other things. There's also instant messaging and text-based services, so those can be used to text clients, for example, to remind them of their appointments, or to remind them of breathing strategies through CBT, for example. So all things that can help and are accessible. These self-care tools are accessible 24/7. There's also access to electronic medical records, and then on a bigger scale, artificial intelligence or big data can be used to learn or analyze and pick up on different trends in your mental health care data to reveal patterns to help clinicians help you. Some other examples are telehealth. So I think a lot of people would think of this as an e-mental health, a primary e-mental health tool. This helps connect people who are not available on site they might be in remote locations, they might not be in somewhere where they can have access to a practitioner of their culture, who speaks their language, etc. So this really helps to connect people through video on the internet to their counselor or their therapist. And then there's some others here for social media. There's websites, sort of peer support websites, forums, and then even wearable technology and virtual reality. So now that you know a little bit of some examples of e-mental health, what really are the benefits? So the main benefit is that it can shorten wait times and increase capacity. So the self-help tools that I was mentioning are available 24/7. So they can be accessed at any time. It also, by the mental health practitioner providing these options, it can help either reduce or completely eliminate wait times by offering these options right away instead of putting people on waiting lists. It can also help increase capacity to free up more clinician time to be able to see more clients. As I was mentioning, it can improve accessibility in multiple different ways, but especially for location. It can reach across time zone by providing rapid access. It's also a cost-effective service delivery. A lot of these applications or websites are actually free or at very low cost for the pay-per-service features. And then finally, these are customizable. So the whole point about e-mental health is that we're hoping to reach the client and provide them help where they are and what services that they're looking to get. So this is an example. This is a really busy slide. I won't go into it too much, but this is just a real-life example of where e-mental health tools can be used alongside traditional mental health care every step of the way. So from interactional self-help to intensive video conferencing, for example. This is an example of our e-mental health demonstration project that we're doing in Newfoundland and Labrador, where they have included e-mental health tools and assessments every step of the way in their clinical practice. So if you're interested to hear more about the demonstration project, I won't be speaking to that more today, but just to give you a real-life example of how these tools can be included in clinical practice to eliminate wait lists. So there is some challenge. You might be wondering, how do I select my e-mental health tools? How do I know what is the right thing for myself, my client, my organization? The problem is that not all mental health apps are evidence-based. They're based on research or are targeted towards all populations. Not all have included the clients themselves in their focus groups. So we, here at the MHCC, we have co-developed a mental health app framework with CIHR to help to make an informed choice about what mental health apps, websites, or tools that you are using. So this is a kind of a guide or framework for how to select your tools. So you should always select tools that put the client first, so really looking at that client service. Has social and cultural relevance for the person that you're recommending it for, has appropriate developmental readiness, so it's suited, the app or the program is suited towards that person's cognitive skills. It also has to consider that patient's access to electronic products. So the client that you're referring it to, do they have access to computers? Do they have access to internet? If not, is there some way that you can facilitate that or create infrastructure to facilitate that? And we'll also be going into just a digital skill set. So do they have those computer skills to actually access those e-mental health tools? Because there is quite a range of skills depending on what tool you're recommending. So one thing to note is that the toolkit, as I was mentioning, includes many appendices and checklists and work plans. So in the tool, I'm not covering all of them, but in the toolkit you will find some even more checklists for how to choose eMental Health tool. So the second module is about actually launching your eMental Health implementation initiative. So the objectives for this is to identify the main steps involved in launching successful eMental Health implementation projects, to identify sources of information and feedback, and then to look at possible indicators to stop, hold, or even scale up your efforts. So what we're looking to do is map the destination. So one of the things that came out of all the key informants and stakeholder interviews for this toolkit is that a lot of people are interested in eMental Health tools and implementing an eMental Health program, but they simply don't know how to do it. So having a plan, a good plan where you're thinking about everything that, what are the things that need to be changed? For example, do you want to have a better clinical outcome? Do you want to have a better clinical process? Are you looking to just increase the adoption of eMental Health tools by care providers? Are you looking to increase the use of these tools by patients or clients? So depending on what you're looking to change within your practice, to establish a plan around those things, you want to locate accessible data. So who are your e-leader champions? Who are those who are going to be putting in place? Who are your human resources that you might need to incorporate to really have a successful implementation? And of course, we always encourage these to be evidence-based. You want to make sure that the research is there, that stakeholders and users have been consulted for your plan. You also always want to consider the costs. So these are not just startup costs for practitioners. These are also the possible costs to your patients if the application or website is not free. And then finally, you want to train and communicate. So it's really important if you're implementing an eMental Health program or you want to incorporate a tool into your practice, that you really manage and build your teams around this, so you establish clear roles, and that you focus on what needs to go right in this implementation and not just what could go wrong. The second stage is the actual launch. So we've provided a countdown checklist in the toolkit. These include very specific things that you can check off as you go to incorporate to implement your plan. This includes pre-launch, launch, and then the post-launch, track any issues and see how things are going on. I won't go into a lot of detail about this. I realize that this is kind of the crux of the toolkit about launching your service, but that's why I encourage you to actually come back and look at the toolkit, look at all the work plans when it's launched next Tuesday. And then 3 is to go full-scale integration. These are to determine next steps. So you want to evaluate how this has panned out, not only for the mental health practitioners, but for the clients, for the workflow, for every aspect. And then you want to see, do you want to hold, stop, or scale up your efforts if everything is going well. So the third module is about building your digital skill set. So I mentioned that previously that not all practitioners are familiar with eMental Health, and they don't always all necessarily have all the skills and competencies to achieve this. So the objective of this module is really to reflect back on skills and competencies and maybe some skill gaps that they might need to fill, as well as looking at some relevant legislation, regulation, and organizational policies that might come up for your implementation plan. So some things to look at when looking at your own e-mental health perception and competencies include e-communication skills. So for example, if you're used to communicating people through face-to-face means, of course e-communication requires just a different lens in how you communicate, how you interpret communications effectively, and then you also have to think about data protection and privacy concerns when you include this in. So on the right here, you'll see a table in blue about some questions that are included in the toolkit to help reflect on your own beliefs and attitudes towards e-mental health that can reveal the messages that you might be sending to colleagues you're talking to about it, or maybe your clients about it. So for example, do I think e-mental health can improve mental health care delivery? Do I find e-mental health tools and devices easy to use and understand? And then maybe have I tested or tried the e-mental health tools before making a commitment to use it? So these are all just helpful things to think about when you're thinking about e-mental health. The fourth module and second to last is really important. It's about engaging your clients in e-mental health. So really engaging that user in everything that you're doing. We're going to challenge some myths about what clients think about e-mental health, and then identify roles for client engagement on e-mental health. So some myths around using e-mental health for clients is that people don't want to use digital services for mental health. They want the traditional methods. They want face-to-face. They want to talk to someone. In reality, people just want access to mental health care and information. Some people, it's appropriate to have face-to-face contact, and that can always be considered in a stepped care model. But a lot of people want rapid access. They might want access 24/7, which is available with e-mental health tools. Or some people might prefer, because of their condition, actually might prefer to not go to the doctor's office, not go to the psychologist's office, and actually get e-mental health tools through website, through teleconference, through the phone, other ways of accessing these services. Another myth is that only young people want to use digital services. So again, this is a myth. About 88% of Canadian households have internet and are accessing internet. A big UK e-mental health initiative called Big White Wall, their average user is 37. And we're seeing an increase in seniors using social media and the internet, so why not provide this mental health option to them? And then finally, I know of course there's a lot more myths, but the fact that patients want the most innovative features and apps, or to roll out an e-mental health program, that practitioners, organizations have to offer a whole toolkit of e-mental health apps, which is not true either. So even incorporating one or two options, or even really simple mood trackers, anything that you can provide as a complementary option to the mental health services that you're providing, really improves access, and it's just another option that we can use to help people. So this is going through the levels of engagement with people with lived experience. So it's really important to include these users in everything that you're doing. So you want to inform them about e-mental health tools via online information or in person. You want this information to be really clear about what you are recommending. You want to engage with them by recommending a tool for a specific purpose. You want to empower them by creating efficiencies in their own self-management of their personal healthcare information, and their care. So by giving them these tools that they can monitor their own records, their own mood, for example, you're really giving them that power back. You also want to partner with them to create synergies between multiple practitioners to kind of create to really communicate between them about the client and their needs. And then you also want to support their e-health community. So if possible, you really want to create this environment where they feel comfortable going to their community online. For example, this might be a forum, and you want to create occasions for e-meetings if possible. So the final module, the fifth and final one, is about leadership for e-mental health innovation. And this is really about forming a common goal or vision for a team or organization that will contribute to the overall aim and success of e-mental health. So as I was mentioning during the planning, it's really important to build and maintain those stakeholder groups when you're implementing your plan. And I only have one slide about this because it's really, if you're really invested in e-mental health and you want to become a leader for e-mental health, you want to know how to create disruptive policy to promote care for your clients. So these are just some of the things that the toolkit are suggesting to champion disruptive e-mental health innovation. So we always encourage you to challenge outdated assumptions, to monitor and review existing developments and rules, and to really open a dialogue with innovators to recognize the role of what's possible, how can we take down silos between industry, government, and the actual clients to make sure that we are really serving the clients as best we can. So the next steps for the toolkit is that as soon as it launches on Tuesday and will be available up on our website, we will be asking for feedback on how the toolkit is being used from practitioner perspective and from users, and then as well as focus groups. It's already been disseminated at some conferences and meetings, including this webinar today. And then we have a workshop planned in March of next year about going through all the modules and hopefully to create eventually a train-the-trainer workshops where e-leaders can really implement these e-mental health tools to others who are interested. So if you'd, sorry about that, I'm skipping ahead. Spoiler alert. Okay. So you can contact me at dimp@mentalhealthcommission.ca if you have any questions about the mental health implementation toolkit or any of our other e-mental health initiatives. So as I was mentioning, the e-mental health demonstration project or collaborative, please feel free to email me. And then you can visit our e-mental health webpage on the MHCC website. This will link the toolkit when it's available, and it also includes our app framework that I was mentioning. There's summaries of all our roundtables that we have completed, and there's also the environmental scan and literature review of the e-mental health landscape that actually led to this toolkit. And I'd just like to thank the IWK Health Center for collaborating on this toolkit, and everyone who's been involved in the launch. Thank you so much for listening.
Thank you so much, Danielle. It was a really great presentation and gave a really good and clear outline of this very useful toolkit, and it's very exciting because it's going to be launched on Tuesday, so people can check it out on our webpage. So just to remind people, we will have a Q&A at the end of the webinar for the last few minutes, but if you do have questions now, you can put them into the chat or into the Q&A box, and we'll note them, and then we'll ask them all at the end. So, with that, I'm going to hand over to David, who is going to present on ThoughtSpot.
Great.
Go ahead.
Thank you, Liz, and hopefully everybody can hear me clearly. Thank you to the Commission for the opportunity to talk about our project, and I'll start by saying I'm always slightly embarrassed talking about this project because I'm just one small person in this initiative. This is an initiative that has been made up of many, many people, including our stakeholders, and I'm going to pick up today on one of the points that was raised in Danielle's wonderful talk, which is around how do we engage, involve, and really enable our stakeholders to be part of the process. And I'll just point out that one of the great contributors to this project is actually on the webinar. Annie Hart was very instrumental in designing a lot of the interfaces and doing a lot of the testing. So this is definitely, it takes a village kind of project. So with that, I'll get started. I'm going to talk a little bit about ThoughtSpot. So this picture that I have up in front of you really speaks to purpose. So this is a picture that came out of a clinic for people with somatic symptom disorders. It was done by a young woman who was asked to express what it's like to have somatic symptom disorder, which is really a physical expression of an underlying mental health issue. And this young woman drew a picture of a fairly normal-looking young lady who's wrapped up in bonds and where the heart should be, a picture of somebody who's extremely isolated. And to me, this helps to sum what is the purpose. And the purpose of ThoughtSpot is really to think about how do we actively engage with students to seek services so they don't feel constrained, isolated, or fearful to access mental health services. So it's not about providing service, it's about thinking about how we access service. So I have a poll question. So I'll ask you to do the first poll question, which is, do you or your organization provide youth and mental health services? So we have the numbers appearing quickly. Give you a second to chime in. All right. So far it looks like we're talking to the right audience. Lots of people providing youth mental health services. Okay. We'll leave it there. So that gives us a good sense that at least a good third of our participants are actually engaged and involved in providing service. Thank you. Thanks for participating. All right. So what does the literature tell us about this particular problem that we're trying to solve? And it's very clear that, there is a huge need. About 20% of this target population experiences symptoms of mental health services, of mental illness or substance abuse use concerns. And we know that it is a system to access services that's very difficult to navigate with a number of different barriers, including accessing those services, a whole litany of stigma issues related to accessing those services that people may experience, and that, to be honest, people providing those services may experience as well. And then concerns about confidentiality. Will people know? What will people think? And those sorts of things. So the barrier to access in itself and to actually reaching out to get those services, we know, is high. Danielle did a very nice job of talking about the potential for online mobile health interventions to get people to access and utilize mental health services. And I think when we're talking about the youth population in particular, although it's not the only population, as we heard Danielle speak about, that is using these services, we know that potentially this particular population spends a lot of time online, and it's a real opportunity to look at alternative sources of providing care. We know that we have the opportunity to reduce access to services and barriers. By using online approaches, we can address some of those confidentiality concerns potentially. We can think about access, and we can think about multiple approaches to encouraging people to access those services. And from my perspective, it's often about meeting people where they are. If people are online and that's where they're reaching out to find services, we should have an obligation to be there. So it's about engaging youth in promoting their mental health well-being where they are and meeting them where they're at. One of the major principles of this project was around co-design and student, and we say engagement, but feel like it was much deeper than that. We wanted to take a participatory approach. We knew that it was going to be important to get youth buy-in. We knew it was going to be important to have youth drive the project. We knew that it would improve our ability to create something that was usable, that was feasible, that was going to really speak to our target population. We knew that by doing this co-creation process, we would have a much more innovative and creative approach. And one of the outcomes, as you'll hear me talk about, is that it was an opportunity to really engage people in a conversation about their mental health, what it meant to them, and how they could improve their mental health and contribute to the community. So there are a number of different participatory design approaches. This particular approach from the Young and Well Research Center really reflects a lot of the work that we did in terms of our ability to sort of identify what the problem is with the target population, define what it was that we're trying to do, take a very much co-design approach, and engage our target population and our youth who are volunteering or also paid participants, employees of the project, to help us not only evaluate but understand how we should develop our knowledge translation activities to promote adoption. And this second slide just gives you an example of how iterative the process is. And one of the caveats, I think, of this process is, while fundamentally our team believes it's the right thing to do, one of the things we learned is how long it actually takes to do this in a meaningful way. And in opportunities where, for timeline purposes or for financial reasons, when we deviated from this very iterative approach, we ended up not being very satisfied with the product. So, and I can provide examples of that. But at the end of the day, we felt that this commitment to the iterative process of co-design was going to lead us to a much better place. Okay, so what is ThoughtSpot? So I'll start by saying that when we started this initiative and we had actually applied for funding to the Ministry of Training Colleges and Universities, they had a call out to improve student health. When we put in the original proposal, I spoke with the team around what the intention was. Really, there was a purpose around making it easier for students to access mental health services, but there was an idea about using a platform that would map and provide access to an understanding of where those services are and how they can be best accessed. But there was very little beyond that, and part of the reason was that the approach was to let students drive what it was going to look like, how it was going to look and feel. And the good example of this was our original title of the grant. First grant was by students, for students, and we thought this was a great working title, and we took it back to the students as we got engaged, and the students said, you know, it's a great project, we believe in it, but the title has to change. We can't call it this. And so they creatively came up with the title of ThoughtSpot and the logo and the branding, and took it from there. So it ended up being a co-created crowdsourced platform to help students seek mental health and wellness services. So it involves a couple of items, which is helping to geolocate mental health services, to encourage students to actually seek those services, to have them reflect on where they are. So our latest iteration, which I'll talk about, has a very reflective part around creating your own thoughts, to encourage people to see what other people have to say about the services, and then to contribute to by adding and tracking their spots and their wellness. Just this is a slide that's not reflective of everybody on the team by any stretch. It's actually an older slide. And Annie, I apologize, I see your name's not there, but Annie's been an important part of the project. And so just this slide is really intended to communicate to people how many people were involved. And this was just part of the core group. And the amount of students who were actually involved in this is really incredible. And I'll show you a little bit of that. The other thing I think that's important about this initiative is truly was about partnerships. So we have partnerships with universities, wellness centers, partnerships with a great development company, QOC Health, who really helps guide us, and partnerships with people who would provide a lot of input. And so at the end of the day, really about involvement and partnership. And each partner provided a different perspective and contributed something unique to the initiative. So where did we start? So phase one was our initial development. I think it's going on at least 4 or 5 years now that we've been working at this initiative. And the project team started with about 65 post-secondary students who we gathered, helped us with a series of co-design activities. We did a number of crowdsourcing and data workshops trying to validate the data set that we had. We held a hackathon, I'll talk about that in a minute, and we engaged with Mind Your Mind in developing knowledge translation and engagement workshops that would really drive the activities, thinking about what should the outcomes be. All right. Oh, so poll question number 2. It's going to appear. Here it comes. So are you familiar with the idea of a hackathon? All right, look at that. We started with lots, and now we're kind of getting, okay. So some people, so that's great. So the, and have you ever participated in one? That's our second question. So some have, which is fantastic. Look at that. We have a couple. Mostly people who haven't participated. Okay. That's awesome. 2 people have participated in a hackathon. All right. I might even know who they are. So our initial phase was about co-creating, and you can see a picture of one of a core group of our original team. You can see some of the original designs there in terms of what we developed. The picture on the lower left-hand corner, that's a picture of our hackathon. And so what happened throughout the process was we developed the online platform. We had a number of spots, and we really wanted to move to a mobile experience. So we had the idea that we would bring together a group of technology experts, mental health experts, students, and people with lived experience for one weekend to really come up with a series of ideas, with the idea that we would pick one of those and further develop it. And in the end, we had about 65 folks who participated. We had, I believe, 14 projects, and we ended with one design that we selected. It was an incredible weekend where, the evaluation from that particular event told us that above all, people had a greater awareness of mental health issues and what it was like to have to be a person with lived experience in the post-secondary institution. We also used a number of creative methods of KT, so we had a spoken word artist at the event who documented the entire event and created a series of poems that captured what the experience was. The other thing that we did throughout was to create workshops that allowed people to express in a number of different ways, including the diagrams and pictures and collages that you see here to express to us what we needed to do and what we needed to build into the app in order to be successful. So that took us to the first phase of our funding. We were then successful in applying for a CIHR grant, which allowed us to do an optimization and redevelopment phase. So we engaged in 2016 in a whole new range of activities, trying to reimagine our application a little bit to further and deepen our engagement. We had a series of people who were involved in user experience, creating community guidelines, thinking about recruitment strategies. Students really gave us a lot of feedback in terms of our evaluation in our randomized control trial. And so the goal was to build a very sustainable app that, for the part of the purpose of the grant, would be to have an application that was scalable and sustainable over time. And again, this is a part of the optimization, another drawing that was a vehicle for people to express to us what people were going through, what they were feeling, and some of the experience that we were trying to build into our particular roadmap in our application. So it was a very in-depth amount of data gathering, and the data ended up being in a whole series of formats. So what did we find? So we found that we needed to create more opportunity for discovery, that the search function needed to be much better in terms of getting people where they wanted to be. We needed to customize the experience. That was what people were looking for. And part of what we were exploring was what hook could we use to keep people coming back. And we landed on this idea, engaging with our advisory group and other student stakeholders, that capturing thoughts and moods was going to be an interesting way to do that. So part of this was to do usability testing. So we tested the application, and a student actually led the usability testing, working with 15 students. We did a series of think aloud exercises, did some field testing, and gathered just a vast amount of data, which we've just pulled into a publication, which we hope will be presented in the wintertime at a conference. This just gives you a little bit of a flavor of the usability testing, and you can see that this was partway through the application development, and while it told us that we had a lot of work to do in terms of quality and systems improvement, doing it at this phase and doing some of the usability testing gave us an opportunity and enough time within the project to adapt what we were doing and accommodate. So this is a quick screenshot. In the interest of time, I won't show the video, but there's a great little video that I'm happy to share if people are interested that talks a little bit more in depth about what this application does and takes you through a little bit of a user experience around downloading, finding a spot, creating a thought, and better accessing mental health services. And so our final phase, which we're in the middle of doing right now, is doing a randomized controlled trial, testing the application. The purpose of the trial is to really look at the impact of this particular app on the ability of youth and students in particular to access mental health services, not access in the sense of actually going to get the access to the service themselves, but of the movement of actually going from the pre-contemplative to the actionable step of accessing the service. So it's around help-seeking behavior. And so we have a number of baseline instruments that people will be going through. We are in the middle of recruitment right now. Recruitment is going well, and we're just actually coming to the tail end of our first cohort that's moved through. So we hope in the next few months the next 6 to 8 months that we'll start to have data that we can share from our trial. The other component I just wanted to add, and you can look at this paper, it's actually open source, and we've tried to make most of our application papers open source so that anybody can look at them. We built in an economic evaluation working with Juan Rudy, who's a health economist at St. Mike's, and she has been guiding us in thinking about what does the economics of this look like in terms of improving students' ability to access mental health services. So quickly, coming to the end of our hour, some of the challenges and barriers. So a project like this, we've gone through many changes in staff, a big turnover in students, and so constantly having to re-energize the group has been quite important. Managing goals and expectations. So I have to stress that the constant communication around goals and expectations for people participating in the project cannot be stressed enough. You really have to continually go back to the whole team and say, is this what you're expecting? Do you know what we expect of you? What do you expect of us? And it's a constant conversation, and it's all about building that relationship between the team and amongst the team. Obviously these are projects on deadlines, and so meeting those deadlines is important. And then balancing, getting it right for the stakeholders and balancing the research. There are a lot of challenges there, and happy to talk about that further. So I'll just end with a few lessons learned. This first point around students must be included at every phase of the project. I can't stress that enough. I alluded to it earlier. Anytime we deviated from this principle, we got ourselves into trouble, and we learned to hold our whole team accountable, that if students weren't involved, if our stakeholders weren't involved, we needed to stop and pause. Need for sustainable engagement strategies throughout the project, and again, identifying clear roles and responsibilities. That stakeholder communication, it's probably obvious to everybody, but I can't stress it enough that that's the foundation of a good knowledge translation project that has co-creation. So I will end there. Thank you very much.
Thank you very much, David. That was an excellent example of a successful e-mental health tool. And also a great example of how engagement is really, really important in co-design for things to be successful. So thank you so much for sharing that with us. We have had a few questions, so I'm going to ask them now. The ones we've had so far are actually for Danielle, but if you do have questions also for David, you can type them into the chat or the Q&A at any time. So, Danielle, are you ready?
Yes.
Okay, so there's a few questions here. So the first question is, how do I get more information on the Newfoundland demonstration project?
So you can contact me, and then I'm also going to put in the general chat a link to the just a little write-up that we have on our website about the project, and then there's a 4-page resource on what we're currently doing. Just to note, we're looking to actually update this very shortly as we're getting our mid-project report, but this will at least provide some more information. So I just posted it to the chat, so you can get information that way or just by contacting me directly.
Great, thank you. And where can we register for the upcoming conference in March 2019?
So registration is not currently open. We will be sending out a targeted invite shortly, is what I can say. So if you are interested in participating in that workshop, the best thing is to just email me directly at dmp@mentalhealthcommission.ca, and I will put you on the list of those interested.
Great. Okay, next question. Are you aware of any public health units that have used e-mental health?
So, I mean, there's definitely a lot of organizations and units who currently use eMental Health. The question was about different organizations that use it?
Public health units. Do you know of any?
Public health units. So, for example, like the Royal Ottawa Hospital and other hospitals and organizations are currently using telehealth. They use video conferencing all the time. It's also going to be incorporated in the stepped care models that are being introduced in Ontario. Vancouver Public Health uses a lot of mental health tools to fight the opioid crisis. So there's actually quite a few public health agencies that are currently using these tools. As I mentioned, the eMental Health demonstration project in Newfoundland and Labrador, that's actually a part of a provincial buy-in for this demonstration project. So the province itself has, with the public health agency there, has actually supported and funded this implementation.
Okay, great. Somebody's asked, is there a list anywhere of suggested apps or programs that follow best practices? So someone was saying that in the UK and Australia there are databases, but does anything exist like that in Canada?
So not that we are aware of. So there are resources like ementalhealth.ca. There's of course our website, the MHCC website, which has on our eMental Health page, it links to a lot of environmental scans and resources where we name specific applications or websites that are evidence-based and that you can go use. So for some examples are Strongest Families. So they're a website that you can access that provides teleconferencing and other eMental Health tools. And also the toolkit itself also provides some of those links, those linked resources I was mentioning. Some of those actually link you directly to the website of the provider of eMental Health tools. Apart from that, we're working with CAHR for an eMental Health ecosystem here in Canada. So right now that plan is on hold, but the rating app came out of that. But we're hoping to continue that work in the near future.
Great. And one more question for you is, are eMental Health initiatives being implemented in remote areas such as the Northwest Territories?
So I don't want to give too much away, but we are hoping that more provinces and territories will sign on for the eMental Health demonstration project and to really provide these eMental Health tools in subcare in clinics. But right now, already in private clinics on their own, there are some clinics that are providing video conferencing and teleconferencing to the territories. For example, they might have a robot in place up there that clients can go. So even if there's not an actual practitioner on site, it can link them to a practitioner who's off site.
Right. Great. Thank you.
I just add to that there was a pilot test going on in the Yukon. I'm not sure if it's still active, using a couple of apps to help provide mental health services in remote areas.
Great. And Anita has just put into the chat 2 online directories that she's aware of, so you can click on those to check them out.
Yeah,
from Australia.
Beacon is actually one of our linked resources that we recommend in the toolkit as well, so they have a Canadian presence as well. Thank you for that.
Great. So we're almost at the end of our time. I just wanted to ask David one question, which is obviously ThoughtSpot took a lot of effort. There were a lot of people involved. How long has the project been going, and how many months did it take to go from the planning to actually getting to the hackathon?
So the project has been going on for 5 months, and I hope people can hear me now. I understand people are having trouble hearing me, but so the project took considerable amount of time to sort of get ramped up because of the engagement activities. But I think the initial build, once we had the project team in place, we had the first website built within six months or so. It was the iteration that really we've been taking time to do. So I think it was 6 to 8 months from the initial design to the hackathon. It was a long time ago, so I have to remember.
Yeah. Well, these are wonderful, wonderful information, and so I'd like to thank both Danielle and David for sharing their work with us today, and we just want to let you know that there is a survey that will be emailed to you shortly after the end of this webinar, and it would be so helpful to us if you actually completed it to let us know how this went for you, and if you have any suggestions for other topics that you'd like to hear about that we could facilitate for you. So thanks so much to everyone who joined us today. Thank you again, Danielle and David, for presenting, and we'll see you at the next Knowledge Exchange Collaborative webinar. Thank you. Bye-bye.